Hey, this is Mark Thompson with the Mulligan Concept Teachers Association. I just want to go over a couple common clinical mistakes that I see people making with the mobilization with movement for internal rotation non-weight bearing. And a couple clinical tips that will just help you along the way. One is get this belt up as high as you can in your patient's groin. Best to let the patient take care of this for you. So I'll get the belt around my patient like this, and I'll ask him to slide this belt up as far as you can up into your groin, if you would, please. All right, let him take care of that. It's much more comfortable riding high in the groin as opposed to down on that adductor. Now, as I come up, I want to think about my belt angles. Is my belt angled down? Is my belt level or parallel to the floor, or is it up? Sometimes people will have this belt at an angle, they don't even realize they're pulling it not quite parallel to the floor. Now, if that's what's working, then that's what you need. But I just want you to know where your belt is. Start parallel. Have that stabilizing hand on the innominate. A lot of times we'll see people back here with both hands on the femur trying to get a force. Well, what happens is the whole pelvis will rock. That's not going to provide the force as nicely as we want. So take that hand inside the belt and up on the innominate, and have your belt length so that you can get that wedged into your ASIS. So you have a good, strong, stable support. Grab the knee with the knee flexed with nice, firm grip. Don't be flimsy, grabbing down at the ankle or grabbing halfway through. If they have no knee issues, go ahead and grab that whole entire leg here. Now, if you have that setup going, take a minute and make sure you're not already applying a force. A common thing that I see is people are already applying a force before they even start. Then they apply more force and it becomes firm immediately when you want a range of forces available to you. So once you're all set up, back off the force entirely and then produce a little bit of an anterior pelvic tilt to get your force. Don't lean back. Just a little anterior pelvic tilt is nice. Once you have that applied and sustained, then you can move into internal rotation. Remember to give that overpressure and come back down. Very useful technique in the clinic, and I hope this small video helps you be more successful.